Hello everyone, welcome to KNO Academy YouTube channel. So in this video, I am going to explain NORCET-8 NORCET-8 main paper. Okay, we have collected 160 questions. Okay, and these many days, just 2 3 days, we were little busy, so hence we have not done the any video. Okay, so I am planning to make three parts. That is three parts. Okay, part 1, 2, and 3. Okay, so in this video, I am going to explain around 50 MCQs. Okay, that will be the part 1. Okay, then tomorrow we will upload the part 2. Okay, so don't waste the time. We'll move on to the first question. Okay, the nurse is preparing a plan of a care for a postpartum client with a small valvular hematoma. The nurse would include which of the specific action during the first 12 hours after delivery. So this we need to read properly. 12 hours after delivery. So question. Okay. So options are encourage ambulation hourly. So this we cannot do. Okay. Then assess vitals every 4 hours. This we are doing. Okay. So vitals we are doing, but that is not related to the it will not related to the hematoma, okay, valvular hematoma. And measure the fundal height every 4 hours. 4 hours sleep, okay, every fourth hourly we are not measuring the fundal height in case of normal, okay. But when we are measuring the fundal height, that is during the PPH. In case of PPH, we will measure the fundal height every fourth hourly. Okay. Then prepare an ice pack for application to the area. This is the right answer. So we can apply the ice pack to the valvular area, that is where the hematoma exists. So that the hematoma will be decreased. So whenever we are applying the code application, the hematoma will be decreased. So option D is the right. Okay. And we'll move to the next question. Newborn cannot pass meconium. This is a very beautiful question. Okay. Even after the 48 hours after delivery, and abdominal distension we can see when assessing the rectal examination profusely passes the gases and stool. What is the diagnosis? That is the Hirschsprung disease. That is also we call congenital megacolon. Congenital megacolon. Congenital megacolon we can call, that is the absence of A ganglionic cells in the rectum. Okay, rectal mucosa we call. Okay, this is and all the necrotic and any unparalytic ileus, that are the wrong answers. Okay, so Hirschsprung's disease is the correct answer. Okay, so this is a very beautiful question and basic question. So everyone we have studied. Okay, this is also you can see this question also we asked in our test series. So I'll tick, okay, whichever questions came from our test series. Okay, this is also from our test series only. Okay, and 2 month infant is having the vomiting and diarrhea, thirsty, drinks water eagerly. What is the grade of dehydration and management? So this is as per the IMNCI. They asked as per the IMNCI management. So the right answer is some dehydration. So we can see here drinks water eagerly. Okay, thirsty. So this is some dehydration because here the patient is, that infant is conscious. Okay, conscious and drinks water eagerly. Okay, uh, moderate dehydration. Okay, this is not right answer, and severe dehydration not a right answer because in this patient will be unconscious. Okay, he cannot drink the water. Okay, so I will show the one more slide, so you can take a screenshot. Okay, so here we can see no dehydration, some dehydration, and severe dehydration. In case of severe dehydration, baby will be lethargic and unconscious. Yes, but here some dehydration. Okay, you can see here drinks eagerly and thirsty. Okay, so that it is considered as a some dehydration, and we can manage with ORS. Okay, that is the right answer will be the some dehydration and management with ORS. Okay, then question number 4. Match the following. That is, we have already arranged as per the matching. First one is JSY, that is the we are encouraging to the institutional delivery, and PMSMA, Pradhana Mantri Surakshita Matritva Abhiyan. Okay, Pradhana Mantri Surakshita Matritva Abhiyan. So this is for uh, screen the ANC for high risk pregnancy. Okay, this is we have arranged. And Laksha is a to assess the labor room quality care. Okay, labor room quality. So that is we have arranged. And Poshan Abhiyan is anyway we all know, that is the nutritional management. So this is the proper arrangement of the question. Okay, so overall done like this, we'll get the 1 mark. And next question, a pregnant woman is having HB 8 gram per DL and physician order iron and folic acid in daily basis, and also she attended the government program in PHC. So PHC, to take that medicine, she attended the government program in a PHC. What is the program they asked? Okay, that is the anemia mukt bharat. That is, so we are providing the anemia mukt bharat, that is iron and folic acid. Okay, iron and folic acid, that is 60 mg of elemental iron, and folic acid will be 100 mcg. Okay, so this is the dosage we are giving. Okay, and chronic, next question. A chronic schizophrenia patient is having end stage renal disease, and he refuses the dialysis, and also he said God will heal me. Okay, what is the next appropriate step as a mental health profession? The question asked. Okay, answer is, take consent from the family members. This is not relevant. And assess the mental capacity of the patient. This is the right answer. I will tell you why. Okay, then use the abrupt language. This is the wrong option. So we need to assess the mental health status of the patient, whether to he'll understand or not. Okay, whatever, if we are going to counsel the patient, whether he will understand or not, that we need to assess the patient. So that's why assess the mental capacity of the patient is the right answer for this question. Okay, so hope you understand. And what is the therapy used for the borderline personality disorder? This is a big topic. So I'll tell that dialectical behavior therapy is the right answer for the borderline personality disorder. Okay, this is the right answer. Whoever have done this will get the marks. Okay, then psychoanalytic is not related, and ECT also not required for this patient. Okay, because of borderline personality. And so right answer is dialectical behavior therapy, DBT. Okay, then question number 8. What is the therapeutic assessment of patient is in lithium therapy? So, right answer, no need to think, that is the serum lithium level. We need to check it out. What is the serum lithium level? That is 0.6 to 1.2. 0.6 to 1.2 is the normal serum lithium. Okay. Then when patient is, see, on lithium only they have asked two questions. So lithium, digoxin, the fixed question for the NORCET. Okay. Whenever you are preparing for the NORCET, just go through these drugs. Okay. That questions also we have asked in our test series. Then when the patient is on lithium therapy, which of the following is not done routinely? Not done routinely. See, lithium is not a phototoxic drug. So LFT we are not doing the LFT for the patient who is taking lithium. Okay. So LFT is not required. So LFT is the right answer. RFT sometimes derange the renal function test will be so there. That's why we are doing the RFT, and PSH also we are doing, and serum lithium level. Okay. So this anyway we have to do this, and thyroid test also we have to do, and RFT also we have to do. Okay, but the right answer is LFT because this is not a hepatotoxic drug. Okay, then we'll move on to the next question. A schizophrenia patient saying that government is fixed the chip into my head. What is the diagnosis? Okay, so this is very beautiful question. So here also we can see flight of ideas. So this is randomly ideas will come to the patient, and that ideas will not be fixed. So this is not the right answer. And delusions is the right answer. Why? So this is a false and fixed. False and fixed belief in the patient's mind. Okay, so that's why delusion is the right answer. Illusion will not be there because this is the perception. Okay, so there is a stimulus will be there, but in case of hallucination, there is no stimulus. Okay, there is no stimulus, and here stimulus will be there. Okay, wrong perception we call. Okay, the right answer is delusions is the right answer. Okay. Then question number 11. When the patient, see, I told you digoxin questions will come. Okay. Then when the patient is on digoxin, the nurse should assess which of the following before administration. So anyway, the right answer is apical pulse and potassium level. Potassium level also we need to check to prevent the digoxin toxicity. Okay. And apical pulse also we need to check to because of bradycardia will happen. Bradycardia will be there. So we need to assess the apical pulse and potassium levels. This is the very necessary in the digoxin levels. Okay. And Which of the following scale is used in the PHC level and community level to assess the depression patient? Okay. Depression. Okay. The Beck's inventory is the right answer because this is a self-reporting tool. Self-reporting tool. Okay. It consists of 9 checklists. Okay. 9 questions it will consist. So this Hamilton rating scale is a that experts will do that. Experts. Okay. So this requires some extra professional uh, manpower. Okay, that's why this is the wrong answer. The Beck inventory is the right answer. Okay, Beck inventory is the right answer. This is very simple tool, that is self-reporting tool. We can done it in a PHC level or community level. Okay, the next question. Identify the ECG. This is atrial fibrillation. Okay, atrial fibrillation. Okay, who are all done atrial fibrillation is the right answer. Okay, same ECG will come. So anyway, in NORCET and all, one ECG question, even NORCET prelims also we got questions, SVT. Okay, so here we got the atrial fibrillation. Okay, so these questions, some while preparing the question, some grammar mistake will be there. Okay, no? Some grammar mistake will be there just because we have collected the memory based question, not the exact question from the uh, system. Okay, so some grammar rearrangement will be there. Okay, na? That you can see. Identify the ECG is the atrial. This ECG refers to the atrial fibrillation. Okay, and Pavlik grip also is called as. Okay, very easy question, easiest question. Okay, there are 4 grips. Okay, there are 4 grips. First one is the fundal grip. Okay, I will take a one beautiful class on this because I used to teach this previously. So very easiest question this one. Okay, Pavlik grip. Okay, that is the fundal grip. Then lateral grip. Then is the okay na first pelvic grip and second pelvic grip. Okay, so this is the as you can see, this is the first pelvic grip, that is the Pavlik grip. Some books they have given the pelvic grip 2, that is the right, that is the wrong answer. Pelvic grip 1 is the right answer. Pelvic grip 1 is the right answer, and this is the third manner. Okay, Pavlik grip, you can see here Pavlik grip. So, and the next question, what is the management of GERD? Gastro, uh, 1 minute, esophageal reflux disease. Okay, that so in this case, burping less frequently. So this won't help. Okay, then thicken formula feed. This will help. Okay, na, to prevent the GERD. Okay, so here if suppose if you are thicken, and also we can use that is small and frequent feed. Small and frequent feed we can give, and upright position. Okay, so this will help. Okay, but option is here thickened formula. So thickened formula will reduce the GRD in the children. Okay, so this is the right answer. And next question, which of the following drug is not having anti-suicidal property? Anti-suicidal property, which drug? Okay, so clozapine, ketamine, lithium, these are all having the anti-suicidal property, but lamotrigine is not having the anti-suicidal property. Okay, so the right answer is lamotrigine. Okay, the next question, which of the following drug is avoided during the asthma exacerbation? Okay, is avoided is, okay na, avoided means, so we have to see here avoided. Okay, that is the atomoxetine. Okay, atomoxetine is a, so it may affect on the sympathetic nervous system. Okay, so actually it won't, this drug is used in ADHD. Okay, so we can't give this drug to the acute asthma or acute asthma exacerbation. Okay, ketamine we can use, ketamine we can use in the asthma, but some books they have given ketamine is the right answer, but ketamine we can give. How? So ketamine having the bronchodilator effect. Bronchodilator effect. So that's why ketamine can be given, but atomoxetine cannot be given. So the right answer is the atomoxetine. Okay. Then we'll move to the next question. When the patient is a typical antipsychotic, okay. So this is very important. Typical antipsychotic always call the EPS, that is extra pyramidal symptoms. Okay. And which of the following symptoms should be closely monitored? We know, okay. I know hypertension, no obesity, and no decreased sexual activity. The right answer is extra pyramidal symptom, that is Parkinsonism, okay, and also maybe dystonia, okay. So tardive dyskinesia. So these are all the extra pyramidal symptoms we can observe in the antipsychotic drugs, okay. And question number 20, when the patient is on clozapine, which of the following should be closely monitored? That is agranulocytosis. Agranulocytosis is the right answer. That is the absolute neutrophil count. Okay, so deranges of the uh, neutrophil count. Okay, we need to monitor the neutrophils while the clozapine administration. Okay, that's the right answer. Agranulocytosis is the right answer. And when the nurse is providing the information regarding the biophysical profile to the patient, which of the following is included? Biophysical profile, we are informing to the pregnant lady. That includes, see, this is the clear cut, we can see muscle tone, breathing pattern, and activity NST is the biophysical profile. Okay, and also here we can see amniotic fluid. Okay, amniotic fluid status also include in the biophysical profile. Okay, so it includes muscle tone. So this is the right answer, not this one and not this one. Okay, hope you understanding very well. Okay, and we'll move to the next question. Which of the following is not included in the well-being of baby in uterus? Not included in the well-being of baby in the uterus. Okay, so the FHR should be, we need to monitor, that is 120 to the 160. Okay, FHR, late deceleration is the right answer. Then amniotic fluid will be there. Then basic variable, that is the that is what we call biophysical profile. Okay, na? Biophysical profile is also called basic variables. Okay, the late deceleration. Okay, late deceleration should not be there. Okay, so see this already in prelims also we have explained, that is wheel chop. Okay, that is, okay, wheel chop, you can see we have already explained. Okay, we will also take one more class, okay, regarding the this one, late decelerations, variable deceleration, early deceleration, okay, acceleration and late deceleration. What are the interventions we have to take under? Okay, then so the right answer is late deceleration is the right answer for this question. Okay, then we'll move to the next question, that is question number 23. Which of the following is contraindications of DPT? Contraindications of DPT. So what are the contraindications? So progressive neurological illness. If baby having any progressive neurological illness, continuing, it's progressing neurological illness, means we cannot administer the DPT vaccine. So this is the right answer. Okay, then which of the following method is used to sterilize the heat sensitive endoscope? Okay, here clearly they mentioned that is the heat sensitive endoscope, so we cannot give the high pressure sterilization. Okay, and autoclave also we cannot do, and dry heat also we cannot do. Ethylene oxide we can do, that is ETO. We call ETO. Some of the hospitals, NABH hospitals and government hospitals, they are doing the ETO. That is the proper method to sterilize the endoscope. And also we can do endoscope. Okay, na probe we can do in 2% glutaraldehyde. If the option is there, means you can also use this option also. We can use 2% glutaraldehyde or else ETO. Okay, the right answer is ETO in this question. Okay, then question number 25. What is the function of limbic system? Limbic system. So we can say that emotions, memory. Okay, so and learning skills. Okay, these all come under in the limbic system. Okay, so this is the right answer. And which of the following is correct option included in the Mental Healthcare Act 2017? Okay, the right answer is ECT cannot be used for minors. Okay, for minors means kids, we are not doing the ECT. Okay, this we need to keep it in our mind. Okay, so here we have not collected the four options sometimes. So because of uh, doubtful of the option, that's why we have giving only the right answer. Okay, then we'll move to the next question. Same, this is also very easiest question. Okay, now play which is used by the toddlers. Toddlers will always do the parallel play. Okay, by seeing one by one. Okay, see this, you can take the screenshot. Okay, later, so it will be helpful for you. Okay, so there are many types of plays: are the unoccupied play, solitary play, onlooker play, parallel play, associative play, social play. Okay, so this we can take a screenshot. Okay. And when the mother said to the child, put all the play item back into the basket, but the child is not listening and doing the same. The diagnosis is negativism. The right answer is negativism, not a autism, not a temper tantrum. Okay, so we can see overall done. This is the right answer because baby is not listening. Okay, and that is called negativism. Okay, and question number 29. Which of the following is best method to management of autism child? Autism child. Okay. So in pediatrics, we'll cover all the topics. Okay. Then the answer is set appropriate environment and handle the child. So we need to set the appropriate environment to manage the autism child. Okay. So this is the right answer for 29 question. Okay. Then identify the image. Okay, this is the bubble CPAP. Bubble CPAP. Okay, so this we have handled. Okay, now this is the oxygen source. Okay, this tube will be connected to the child, and here now, so we can fix the PEEP. That is bubble CPAP. So here we can see the bubbles. Okay, so how much PEEP we want, that centimeter square we can fix here. Okay, so this is the bubble sip. The answer will be the bubble CPAP. Who are done bubble CPAP will get the mark. Okay, then question number 31 is the toxic erythema. Okay, right answer is the toxic erythema. Then identify the uh, device given below. That is the Haberman feeder. That is for the cleft palate. Okay, Haberman feeder. Okay, this is the special type of nipple you can see here. Okay, this is the lengthy one. So this is used for the cleft palate babies, so to feed very easily. Okay, that is the Haberman feeder is the right answer. Then here you can see that is the variable deceleration. See here, here, here. So this is the CTG. It's called variable decelerations. Okay, so here also same what I told, wheel chop. Okay, we will explain in detail in next video. Okay, so this is compression, cord compression. Okay, na VC means cord compression. So here mother need to turn. Okay, so we need to move the mother. So clear this. Okay, earlier deceleration means head compression. Okay, so like this we need to read. Okay, so we can see the variable deceleration here. Identify the graph of CTG they have given. And question number 34 is the Steven Johnson syndrome. Steven Johnson syndrome. This is due to use of more anticonvulsant and some antibiotics also. Okay, Steven Johnson syndrome. So this patches, whatever you see, is the classical sign of a Stevens-Johnson syndrome. Okay. Then, while managing the unresponsive patient whose GCS is 4 by 15, which is the best method to administer the vasopressor? So, here the right answer is 82. Because, so whenever the emergency situation, okay, the GCS is only 4 by 5, okay, and we may not get the IV access. Okay, whenever we are not get the IV access, the right way is the 82. Okay, LMA we cannot give, that is the laryngeal mass carrier only, so that won't reach the lungs and all. So 82 we can give to fast acting. Okay, so vasopressor we can give to the in 82, that is adrenaline and all. Okay, if you're giving adrenaline, we can use the 82. Okay, and question number next. Hypodermal implant contraception is advised to see the contraceptive questions are very important. Even in last prelims also they asked. Okay, so this is hypodermal contraception. See the this will be implant in the patient's arm. Okay, so the right answer is okay na women who are unable to take estrogen progesterone for 3 years. This will be at up to 3 years. 3 years it will act. Okay, so DPMA will be 3 months only. This is 3 years. So suppose if they are unable to take daily, okay, oral contraception, or 3 months they are not ready to come for the clinics and all, so they can take for a. So once if we implanted, it will okay na duration will up to 3 years. So who are all unable to take estrogen and progesterone for 3 years is the right answer. So in option they are given 3 months. Okay, so like that they are given, but 3 years is the right answer. Okay, so hope you understood. Then question number 37. Here we can see question number 37. 666 strategy is used for 666 strategy used in not a tuberculosis. Yes, anemia that and not a cancer. So anemia is the right answer. That is the anemia mukt bharat. Okay, that is the six beneficiary. Okay, then six interventions and six institutional mechanisms. Six institutional mechanism. Okay, these are all the 666 strategy. So anemia mukta bara. See, the nowadays the questions are asking from the programs. Okay, so we need to read all program thoroughly. Okay, so this is the anemia is the right answer. Okay, then key pillars of PB under NEEP. That is very beautifully they ask question. This is very easy question. So that is the detect, treat, prevent, and build. So we need to detect early. Okay, treatment also we need to proper treatment. Then prevention. So preventive measures we need to take. Build means that is the to strengthen the healthcare facility. Okay, strengthen the healthcare facility is the right answer. That is the detect, treat, and prevent, build. Okay, so key pillars of the TB program. Okay, and question number 39. What is the time interval for DMPA contraception? So this even last NORCET also means glimpse they asked. Okay, that is Antara injection. So they gave image based. Okay, Antara. Okay, so very beautifully they are asking questions, very easy questions. Okay, so what I feel this NARCET mains was very easiest paper. Okay, even prelims also and mains also. Okay, but the same questions are repeated, even around 5 to 6 questions are same questions repeated in the NARCET mains. Okay, what is the time interval for DMPA contraception? That is every 3 months. I told previously also every 3 months we are giving the DMPA injection, that is Antara. Okay, the government is providing the brand name is Antara. Okay, then what is the stage of malnutrition? Weight for height. So here this is very important. Weight for height. Okay, na? Then that is below Z score about 22.8 kg. So that is a moderate wasting. Okay, so this also It's a very big class. We'll explain in other class. But the right answer is moderate wasting is the right answer. Okay, overall done this, we'll get mark. Okay, then question number 41. 41 is the child with hemophilia A got bleeding in joint. Okay, what is the priority nursing care? So always when hemophilia A will comes, we need to administer the factor 8. That is the clotting factor for the hemophilia A clients. Okay, so that is factor 8. Bleeding in joint, that is very common classical symptom in the hemophilia patients. Bleeding in joints. Okay, read carefully. Okay, administration of factor 8. Okay, so this will be the right answer in the question. Then see the same question asked in the prelims. Okay, that is National Deworming Day is observed on, that is February 10 and August 10. That is biannually we are doing in our India. February 10 and August 10 is the right answer. Okay, so that's why they given that don't forget your prelims. Okay, so same questions repeated in the prelims questions as in main question. Okay, then question number 43. At 38 weeks of gestation, delivered a baby with petecia on the face. What is the cause? Positive organism is always parvovirus. Okay. This question also we have given in prelims explanation. Okay, you can see that parvovirus is the right answer to this question. Okay. And a patient with 28 weeks of pregnancy comes with painless vaginal bleeding. Painless vaginal bleeding is the key. Okay, painless vaginal bleeding, but FHR is normal. Okay, what is the diagnosis? In last prelims they asked painful bleeding. Okay, na with pain like that. So that is the abruptio placenta was there. Okay, but here placenta previa. So placenta previa and abruptio placenta is just okay. We can see okay, placenta previa is the this placenta is situated. So placenta will be situated near to the os. That is placenta previa. The abruptio placenta is in the, suppose this is the uterus. Okay, that is the premature separation of the placenta from the uterine layer. That is called abruptio placenta. But placenta will situate near to the os. Okay, there are stages will be there. So that also we will explain in upcoming videos. Okay, don't worry. So here in that painless vaginal bleeding will be there. But in case of abruptio placenta, pain will be there. That is the main key difference. Okay. So placenta previa is the right answer. Okay. The next, which of the following best describe the melancholic depression? Melancholic depression is always anhedonia, decreased activity, mood. Okay. So anhedonia is early fatigability and not interested in anything. So that is the melancholic depression. So question number 45, the answer is severe anhedonia and decreased activity and mood. And what is the complications of epispadiasis? Epispadiasis is the one it's happening in the male child, that is the urethral opening is above the okay is above upper side. Okay, that always complication will be the urinary incontinence. Hypospadiasis is below the okay penile region. Okay, so this is epispadiasis and hypospadiasis. For this question, the right answer is urinary incontinence. The next question, what is the difference between delirium and dementia? So that is delirium and dementia. There are two questions asked. I will explain next question in the next session. Okay, so for this question, delirium is the okay na delirium and dementia. Okay, this is the chronic one. This is the acute one. Okay, na? So altered consciousness always will be in the delirium patient, but not in the dementia patients. Okay, there is no altered consciousness in the dementia patient, but delirium it will be there. This is the chronic one, but it is irreversible. So dementia and delirium. One more question is there. I will explain in that. Okay. So the for this question, so option is altered consciousness throughout the day is the right answer for this question. Difference between delirium and dementia. One more question is there. Okay. Same question only. Okay. Then what is the priority nursing care of a patient with SpO2? That is the saturation 85% on room air is. Okay. So nasal cannula, we cannot provide 100% oxygen. Okay, and rebreather mask. Sorry, non-rebreather mask. I will tell you, rebreather mask and non-rebreather mask. I can tell you. Okay, and deep breathing exercise won't help. This is also won't help. The non-rebreather mask will help. This we can administer up to 15 liter of oxygen. Okay, 100% of oxygen we can give. That is the high concentration mask we call high concentration mask. In this, what will happen? Non-rebreather mask means once breathed, exhaled CO2, patient cannot take it back. Okay, na? Patient cannot take it back. That is the non-rebreather. Non-rebreather means he cannot rebreathe his own exhaled CO2. Only fresh oxygen only he can inhale that. That is the non-rebreather mask we can give so that the oxygen saturation will increase up to 100% we can make. Okay, so hope you understood this. And question number 49. A child with croup. Okay, doctor advised to keep the child in mist tent. Tent will be the mist tent. The child is irritable, crying, and try to coming out of the tent. What is the nurse's action next? Take a prescription for mild sedation. No, cannot give the sedation to this child. Allow mother with the child for the mist tent. So this is the right answer. We can allow the mother to stay with the child. Okay, na? For mist tent. Okay, this is the right answer. Then question number 50. A patient with pain scale of 8/10. Okay, maximum dosage of analgesia given already. Okay, pro IV given. Okay, after 1 hour, patient again complaining severe pain. Okay, what is the priority nursing action? So for this, we cannot give extra whatever doctor advised, that much only we can give the sedation. So if suppose if you want to give more sedation, you need to discuss with the physician for further management. That is the right answer. So we need to discuss with the physician for the right drug and prescription. Okay, that is the right answer. So this is the 50 questions. So part 1 we are complete. I am going to complete in this question. So please be stay. Okay, please stay tuned. So that is around 160 questions we will explain in upcoming videos. That is already 50 questions over. Okay, and also from KNO Academy, from KNO Academy. Okay, they are releasing the test series for NORCET-9 test series. Okay, NORCET-9. Okay, so very minimal charges they kept. Okay, and here I am going to tell what is the benefit of. So benefit of KNO test series is weekly live classes in app. Okay, live classes in app. Okay, whoever take the subscription will get the live classes from KNO Academy, and also doubt clearing sessions in WhatsApp group. Okay, and very beautiful one more they prepared, that is the daily daily two test series, that is morning subject wise and evening grand test, that is as per the NARCET pattern. Okay, so like this they are giving 6 months till September. Okay, na? So that is May 10th. May 10th onwards, that series will be started. Okay, 6 months validity will be there. Daily two test will be there, and very minimal charges will be there. So now currently we can use KNO 300 coupon code for subscription. Okay, so this is the what they plan for the NASA test series. So we can see that many questions have came from previous test series. Okay, around 60 people. Okay, around 60 people cracked the NARCET prelims and they have written the mains test. So we will announce once the NARCET mains results. Okay, so how many people are cracked from our KNO Academy. Okay, so hope this video is helpful. Okay, if you have any doubts in the questions, okay, you can comment in the comment section. Okay, so welcome. Welcome to the KNO Academy, and thank you so much for watching the video. Okay.